Okay, so today we're going to talk about twins in action, that is leiomyosarcoma versus GIST. And what is GIST? Gastrointestinal stromal tumor. So we should be super clear with these. So if you want to understand, the question that is always asked to you is cigar-shaped nuclei. So that is very typical of smooth muscle tumor, that is leiomyoma, leiomyosarcoma. GIST does not show cigar-shaped nucleus usually. So whenever we talk about them, why they are called twins? Because they are both mesenchymal tumors. So both of them are mesenchymal tumors. So that is one point which you should be very, very clear. Okay. Now, remember when we talk about GIST, 85% of them usually arise either in stomach or the small intestine. Although they can occur at other sites also, but 85% is a huge number which occurs basically in stomach and small intestine. Whereas when we talk about mutations in GIST, there are very particular mutations which occurs in GIST, that is KIT, PDGFRA, and succinate dehydrogenase mutation. So SDH mutations are very common in pediatric age group, and these are the typical enzyme mutations which are found in GIST. So whenever we talk about syndromes which are associated with GIST, remember they are typically associated with NF1 mutation, which you have to remember. And then we have Carnase triad, which is very popularly called as GPC. That is, they have GIST, paraganglioma, and chondroma, whereas Carney strataki is a two word. So this is a dyad. It is only GIST and paraganglioma. So there are only two things here. Apart from that, you have to know the inheritance also. So Carney strataki syndrome is an autosomal dominant disorder and usually occurs in children or young age people. Whereas Carney triad, it's triad. So it's non-hereditary. Okay, triads are non-hereditary. And this occurs usually due to hypermethylation of succinyl dehydrogenase C promoter region. And it usually occurs in young females. Okay, so that's an important thing that you have to remember. So that's the difference between a Carney triad and Carney strataki syndrome, which you should be very clear. Apart from that, NF1 mutation typically is associated with GIST. Okay, so apart from neurofibroma, please remember, apart from neurofibromas, NF1 mutations is also associated with pilocytic astrocytoma, which is one of the brain tumors of children. So pilocytic astrocytoma, which you have to remember. Now you also have to remember GIST. Okay, so these are three common associations with NF1 which you should be very, very clear. Okay, now once we are very clear with this, always remember what are the IHC markers of GIST. So whenever we talk about IHC marker of GISTs have to be differentiated from leiomyoma and leiomyosarcoma. So leiomyoma and leiomyosarcoma are smooth muscle tumors. You have to be very clear with this. Okay, so first, how do you differentiate GIST from leiomyoma? Remember always, whenever we talk about GIST about 95% or more than 95% are positive for CD117, and that is why CD117 is also called c-KIT. And remember, that is why we give a therapy in these cases, which is imatinib. So that is why, because 95% of the GISTs are CD117 positive. Apart from that, the new marker that has been discovered is dog1. Okay, discovered on GIST. Okay, so that is why dog discovered on GIST. Okay, and it is found positive in nearly 97% of GIST, which is a huge number. That is why it is considered as one of the most specific marker of GIST. Okay, so that is what you have to be very clear with. Okay, apart from that, a new marker which has come up, but it's not very good marker. Okay, so that is PKC theta. Now, what about CD34? CD34 is a marker for stem cell and it can be positive in GIST, okay, and it can also be positive in leiomyomas, okay. So this is one marker which is CD34 is a marker of stem cells, and it also comes into the endothelial cells of the blood vessels. So a lot of blood vessel proliferation whenever it is there, so CD34 can be positive in that tumor also, okay. Now, coming to leiomyomas and leiomyosarcoma, both of them are smooth muscle tumors, so they are negative for CD117 dog1. PKC theta can be positive in leiomyosarcoma, so that is why it is not a good marker. Remember, leiomyomas and leiomyosarcomas are usually positive for Vimentin is a mesenchymal marker, so it's positive in both GIST and leiomyomas. Okay, so it's not specific. So remember, here we have Desmin. So Desmin can be positive, although we say Desmin is positive in skeletal muscle, but it is positive in leiomyoma and leiomyosarcomas also, and especially in leiomyosarcomas. Apart from that, Caldesmon is a new marker which is positive for leiomyoma. So Caldesmon is a new marker which is positive in these smooth muscle tumors. Okay, so these are the IHC markers for the smooth muscle tumors which you have to remember, and it is different from GIST. Okay, so once we are clear with leiomyoma versus leiomyosarcoma, so once we are clear with GIST, now let's come to leiomyoma versus leiomyosarcoma. So leiomyoma is a benign tumor of the smooth muscle. Leiomyosarcoma is a malignant tumor of the smooth muscle. Okay. Now, because it's leiomyoma, so they usually arise from muscularis propria. So what is this muscularis propria? So the cell of origin is muscularis propria. Whereas when we talk about gist usually arises from the interstitial cells of Cajal. Interstitial cells of Cajal. So that is the cell of origin of gist. So that is the difference between gist origin versus leiomyoma and leiomyosarcoma, which you should be very clear. Okay. So once we are clear with this, you have to understand that when we talk about sarcomas of the uterus, according to the CAP criteria, we can have leiomyosarcoma. Apart from that, we can have endometrial stromal sarcomas also, which can be low grade or high grade, or we can have adenosarcomas also, in which the glands are benign but there is malignant smooth muscle cells. Okay. Apart from that, we have complete rhabdomyosarcoma, which is a skeletal muscle tumor which can occur, and then we can also have perivascular epithelioid cell tumor, which is rare. Okay. So these are common ones we should remember. So leiomyosarcoma and endometrial stromal sarcoma and adenosarcomas are very common uterine sarcomas that you have to be very, very clear. Now, what is characteristic of any smooth muscle tumor is their cigar shaped nucleus. So both the ends are blunt. Okay, so that is something which has to be very clear. Blunt nucleus. So remember, cigar shaped nucleus, when somebody says, it is usually skeletal muscle tumor. Okay, apart from that, like wavy nucleus. So whenever somebody says, that is positive for neural tumors. So neural tumors have wavy nucleus. That is what you have to be very, very clear. Okay, wavy nucleus is neural. Cigar shaped nucleus is leiomyoma versus leiomyosarcoma. So that is something which you should be super clear with. Okay, apart from that, what differentiates leiomyoma versus leiomyosarcoma is Stanford criteria. Remember it as man. So whenever any tumor has a mitosis which is more than 10 per 10 high power field, or there is an atypia, nuclear atypia, or coagulative necrosis, that fits into the criteria of leiomyosarcoma. So that is your Stanford criteria, which is used for the diagnosis of leiomyosarcomas. Okay, so that is what is important. So any you have to always look for mitosis, atypia, and necrosis to make a diagnosis of leiomyosarcoma. So once we are very clear, let's come to some MCQs here. Also, what are the syndromes? Somebody asked you, what is the syndromes which are associated with the leiomyosarcomas? So leiomyosarcoma has a very characteristic syndrome which is called as hereditary leiomyoma and papillary renal cell carcinoma syndrome. So whenever we talk about hereditary leiomyoma and papillary carcinoma syndrome, it is associated with leiomyomas, but it can progress into leiomyosarcoma. Otherwise, leiomyomas are not the precursors for leiomyosarcoma. So always remember, leiomyomas are not the precursors for leiomyosarcoma, but in hereditary leiomyoma, papillary renal cell carcinoma syndrome, leiomyosarcomas can arise from leiomyomas. Okay, so that's one exception that you should be clear. So once you're clear with this, let's come to some MCQs here. What is the most important IHC marker of diagnostic gist? I hope everybody remembers. It is always CD117, that is c-KIT, which is one of the very good marker. Okay, smooth muscle antigen is again, name itself says smooth muscle antigen. So it's smooth muscle antigen. So it's positive in smooth muscle tumors, that is leiomyoma and leiomyosarcoma. Desmin is also positive in your leiomyomas and leiomyosarcomas. It can be positive. S100 is a positive for neural tumors. Okay, so whenever we have nerve tumors, they are usually positive for S100, or whenever we have melanin, or whenever we have cartilaginous tumors. So these are the some tumors which can be S100 positive, any neural tumors, any melanin, or any cartilaginous tumors. Okay, so that's the point you should be super clear with. Okay, now what is the targeted therapy with imatinib is most effective? And this is one of the PYQ which you should be very clear. So this is very, very effective in GIST. That is what you have to remember. So targeted therapy with imatinib is very suggestive of, very, very typical of GIST. Why? Because imatinib is a tyrosine kinase inhibitor, and c-KIT belongs to the tyrosine kinase pathway, and that is why it responds to imatinib. Okay. Now, leiomyosarcoma typically arises from which layer? So I have already told you, it typically arises from muscularis propria. So something which you should be very, very clear. Remember, both GISTs and leiomyomas are typically subepithelial tumors. So they are usually subepithelial tumors because the epithelium over them remains intact, because interstitial cells of the Kajal, which are also called as pacemaker cells, also are present in the or back plexus of the muscles. And leiomyosarcoma is a smooth muscle tumor, so it arises from the muscle vascularis propria. So epithelium above always remain normal. So this tumor usually is a smooth muscle tumor, mesenchymal tumor, which are usually subepithelial. Okay, so that's one pointers which you should be very, very clear. So once you're clear, always remember, strive not to be a success, but rather to be of value. So yes, so that's Albert Einstein's question, quote, which you should remember, and learn things and be more useful for the society. Yes, if there are any question and answers, you can ask for now. And if there are any queries which you have afterwards also, you can always ask me on my Insta channel, that is Dr. Vandana Pathology, where I'll be happy to take your queries. Okay, right. So Dr. Vandana Pathology. Everything is Dr. Vandana Pathology for me. Either it is a Telegram or either it's an Instagram. Right, guys? So with that, that's all for today. Happy studying. Good night. Bye-bye.